Good afternoon. Welcome to everybody. My name is Danielle Maynard, and I'm the director of the HBCU Mentoring Program. Welcome to the Exploring Specialties in Medicine session 2. So we have four wonderful panelists. We'll jump right into them. But before that, I'd like to encourage you to follow our LinkedIn page. This is where you will see all of our upcoming workshops and sessions. But importantly, this is where we also share opportunities like summer programs, postbacks, as well as scholarships. So just scan the QR code and you go to our LinkedIn page, or you could search the HBCU Mentoring Program. There's also a YouTube channel where you can find all of our past workshops and where this session will be posted in the near future. Also, as a reminder, this is the third year of the series. And so if the specialty you're interested in or specialties you're exploring are not listed this year, perhaps we've covered them in previous years, and you can find all of these recordings again on our YouTube channel. So be sure to go to the YouTube channel, just search for the HBCU Mentoring Program. You can follow the channel and you can go to the individual videos to find all these wonderful presenters. So we're gonna jump right in and begin with Dr. Jessica Queen.
Okay, so hi everyone. My specialty is infectious diseases. And I've got this picture of the book, The Hot Zone, on my first slide, because this is what first piqued my interest in infections. I read the book my freshman year of high school. It's kind of a dramatic description of the Ebola virus and some of the outbreaks that it has caused. And I had always been interested in science, but this really just grabbed my attention. I thought it was really interesting and fascinating what these microbes could do to cause disease and impact communities. Next slide, please, Danielle. And so in addition to kind of my scientific curiosity, the other thing that first got me interested in the field of infectious diseases is just the ability to make a big impact. So, globally, infections are largely a reflection of disparities, socioeconomic, political unrest, et cetera. Those things tend to go together with lots of illness and death related to infections. So infectious disease, or ID, kind of married my scientific interests and then some of my own sort of personal beliefs and convictions about what was important. So this is an overview of how I got from where many of you are to where I am now. You'll see this encompasses about 20 years if you look from the beginning of when I started college. Now, I'm a physician scientist, and I did formal training in both medicine and research. So I have an MD and a PhD. And so I took a longer path than is strictly necessary just to go into ID. So if you're not interested in doing dual degree training or extra experiences to get trained in research, basically from the time you graduate college, you can be an infectious disease attending physician within 9 years. I just took a longer path. Sorry, if you could just go back one slide. I just want to briefly recap what each of these steps are. So in undergrad, I majored in biochemistry. I took a gap year and did a post-bac research experience at the NIH through their ERDO program, which is currently on hold, but I'm hoping returns because it's a great experience. I went to Northwestern for my MD and PhD. That took me 9 years. I did my residency at Cornell in New York City, and then my fellowship here at Hopkins, where I then joined the faculty. Okay, next slide, please. So one of the most important things that I did to sort of gain experience and open more doors for my future was to dive into research experiences. I did an undergrad thesis with one of my college professors studying neural stem cells. I did summer internships at other institutions. And then, as I said, I spent my gap year at the NIH doing a cell biology project. And I mentioned the topics just to note that I knew early what my passion was, but I gained a lot of skills and experience in other areas that I still use today, even though they weren't precisely what I wanted to spend my career on. So I just want to encourage those of you who are still exploring not to have tunnel vision and, to get diverse experiences. So during grad school, I did my thesis work on cholera, which is a diarrheal disease. I got to, become really adept at research skills, go to conferences around the country and abroad. That picture in the middle is from a trip I took to India and Bangladesh. I got to present my research and then see some cholera vaccine field sites, which was a nice, just like real world connection to what I was doing. Next slide, please. And then, as I mentioned, I did my residency in New York in internal medicine. So I knew I was interested in infectious disease when I started med school, and I was really just debating whether I wanted to do adult or pediatric ID. So during my med school rotations, I realized that I liked adult medicine more. So to do ID, you have to either do as I said, internal medicine or pediatrics, depending on what population you want to work with. And then next slide, please. Then you do a fellowship to get your subspecialty training. I did mine here at Hopkins. Typical ID fellowships are 2 years. Some programs like Hopkins provide extra time to do research for those of us who want to have our own labs or have a research intensive career. So I had a 3-year fellowship and then actually an extra year of research, postdoctoral research. And that was necessary because in order to join faculty and open your own lab, you have to have a certain amount of grant support. And so it takes extra time to get that into place. So I want to just briefly mention that, telling this all in retrospect, it sounds like I had a goal, I checked off every box, and I achieved it, but there were many challenges along the way. And I'm happy to, answer questions in detail about that, but just to highlight a few. I am the first person in my family to get a graduate or medical degree. My dad had been the first in his family to go to college, and on my mom's side, my sisters and I were first to get college degrees. And so I thankfully had good mentors at my university, and I did a lot of searching on the internet. That's how I found that dual degree programs existed, and that's how I sort of navigated many of the steps of this path. Like probably many of you, I had to work part-time during college. I tried to seek out opportunities that added to my resume, such as doing work study in a research lab. I definitely had academic challenges, such as the typo in how I spelled academic on this slide. I had to retake the MCAT. That was a big part of taking a gap year. I did not score well the first time, and that was largely because I couldn't afford a prep class, so it was very much self-study. I failed an exam in medical school. It felt like the end of the world at the time, but it was not. Life keeps going on as you pursue your dreams. I had personal loss. My dad passed away when I was in med school, and I had to deal with grief while still trying to, achieve. And I just want to mention, because I think this happens to all of us, and you may not realize without more experienced perspective, that there are a lot of what I call dream killers out there. My very first med school interview, my first interviewer of the day, basically told me that I would not succeed, that I didn't have what it took, wasn't impressed by my grades. He thought I would struggle, and he said very clearly that I would never end up where I am today. I had a very similar experience at one of my residency interviews where another person told me, oh, my PhD research was mediocre. My idea of a physician scientist career was very difficult to achieve, and I should reset my expectations. And it's very easy when you already have that voice in your head telling you that you don't belong, to hear those words and internalize them. But clearly those people were wrong. I ended up accomplishing what I wanted to at a very good institution where a lot of people value me and my work. So I just want to encourage you that if you have encounters like that, to, put it in perspective that that's one person's opinion and they don't have the ability to limit your potential. So what I do now, I spend the majority of my time doing research, sort of translational research in a lab. Within that, I do a lot of teaching and mentoring, which is a part of my job that I love. I spend about 20% of my time, so that equals out to 6 to 8 weeks out of every year, seeing patients on the inpatient ID consult service. And then I do a lot of work trying to amplify entry of diverse populations into medicine and biomedical research. So things I love about my job, I get bored by routine. So I like the fact that it's different every day and I can research things that I'm interested in, and then going between the lab and patient care sort of scratches different parts of my brain. If you've been paying attention to the world the last several years, you've noticed that infections impact all of us, and there can be new and emerging ones that really like sort of throw a bomb in the middle of normal function. And so ID specialists are important, and we get to respond to new pandemics. It's very rewarding, obviously, to help take care of people and get them feeling better. And also the joy of discovery and research is really exciting. So I'll stop there.
Thank you. Thank you so much, Dr. Queen. We're going to move right along to Dr. Marshall. We'll take all of the questions at the end.
Thanks. That was really great. I actually very much enjoyed that presentation as well. My slides are not as nice, but I'll go through a little bit of my journey. So I'm starting with like who I am now and what I do. So I am an associate professor of oncology, which means that I am in academic medicine. I don't know that I had an appreciation for what that even meant when I was in college, but I do on any given day, probably about 20 to 30, 40% of my time is spent doing clinical work, seeing patients on the outpatient setting and on the inpatient side, taking care of patients who are in the hospital. And then the rest of the time is in research. That I do mostly clinical trials or translational work. So that means, questions that come up in clinic. It's actually interesting that Dr. Queen is doing stuff on the microbiome because I actually have a collaborator, a PhD scientist collaborator who just from talking and clinical observations that I've had and stuff that she's done in the lab, looking at how the gut microbiome changes in response to therapies that are given for prostate cancer. Now we're doing a clinical trial where we are trying to alter the gut microbiome. So my specialty is medical oncology. Within that, I specialize in prostate cancer. Because I'm at Hopkins, I'm sort of allowed to be that specialized. Most other places I would either sort of be a specialist in genitourinary cancers or just see patients with all different types of cancers. But here we're pretty specialized. So the bulk of my clinical time and all of my research time is spent in doing stuff related to prostate cancer. So how I got here, I'm from Westbury, New York on Long Island, about 30 minutes outside of Manhattan. I went to Harvard for undergrad. I will say the biggest thing that helped me in college is mentors. And I can't underestimate or underemphasize to you guys how important having mentors and having people who believe in you and who are going to help you along the way are to your success. It's essential. I majored in evolutionary biology, had a minor in health policy and Spanish, and then spent my summers working at Columbia Medical School in New York. And during the academic year was working at the Harvard School of Public Health. And initially I was thinking I was going to do health policy. So it's sort of okay if what you do right now is not necessarily like where you end up. Those, I think the main thing was to find, again, mentors and to gain skills that can be used across disciplines. I went to medical school here at Johns Hopkins. I did only a medical degree, so I have an MD. Actually, I do have a master's in public health too. I did that for 1 year while I was in medical school. And then residency is in internal medicine, which I also did at Hopkins. That's 3 years. And then fellowship is in medical oncology, which I have to do after internal medicine, and that's another 2 to 3 years. So most medical oncology programs are combined with hematology. So if you do hematology and medical oncology, it needs to be 3 years. But if you do just one, it can be shorter than that. And then my faculty position I took here at Hopkins. That's it.
Thank you so much, Dr. Marshall. So we're gonna jump to Dr. Anderson.
Hi, everyone. Can you guys hear me okay?
Well, no, you're muted. Okay.
Can you all hear and see me okay? I'm not sure if my camera is working.
I can hear you. We can't see you, but that's okay if your camera. Oh,
Okay,
there
can you
go.
see me now?
All right. Yeah, yes.
Awesome. Hi, everyone. Will you advance the slides?
Yes, I will.
Okay, awesome. So I just want to start off by introducing myself. So I'm Shannon. I'm a first year cardiology fellow here at Hopkins. Really excited to chat with all of you today about my journey to medicine. So starting off, I'm just going to tell my journey through a series of pictures because, as they say, pictures are worth 1,000 words. So I was born in Prince George's County, Maryland, which is not too far from here, actually near the Washington, D.C., Maryland border. And I was born to two doctors as parents, so definitely introduced to medicine early on. I will say that where I grew up, and you can show the next photo too, it's okay. Okay. Where I grew up in Prince George's County, it's one of the most affluent African American counties in the United States. And that was very significant to me because growing up, I was able to see doctors, lawyers, people that looked like me in positions of influence. And I think that really inspired me to reach for the stars. So going next to kind of early on these are just embarrassing photos of me, and I promise this isn't me just reminiscing. They all have significance. But earlier on, I was very thankful to my parents for fostering my interest in medicine through extracurricular activities. And these are photos of me at leadership camps in the summer. I don't know if anyone is familiar with Lead America, which is a big corporation throughout the United States that hosts different camps for those that are interested in whatever engineering, science, math, etc. And so it's a time to branch upon those interests. And on the photo on the left is me at UC Berkeley, where I did my first program in medicine, which meant a lot to me. And on the right is me in New York in one of the I want to say it was at Columbia, and that was for forensic science. So as you can see early on, just interested in science in general, but trying to explore those interests along the way was something that was really important. In high school, I took a lot of time to enjoy friends, and this is just me here pictured with friends, and you'll see that not one of these photos will be me with the book because I wanted to highlight that although yes, a journey into medicine and academics are important, but it's the fostering of the whole person that we want to also cultivate and encourage. And so while in high school, I was believe it or not, these are this is the honors English class here. I was in honors classes, and at that age, I was learning that it's okay be to be quirky, be smart, and be an individual, and foster those interests um, through extracurriculars. And so that prompted, gave me my confidence going into college, where I attended a historically Black college and university, which is Hampton University in Hampton, Virginia, where I cheered and was also in honors college, which again are for those that are interested in more advanced classes. And during this time, again, not only did I continue to do what was important to me outside of class, but I was able to meet like-minded individuals through an academically challenging setting. And that really helped me kind of not only narrow my focus, but also put me around people that were able to motivate me. And secondarily, I will say, while in college, um, obviously, not everything is smiles and easy during that time. Although there were a lot of highs, I had personal challenges that were very significant to me. My mom was unfortunately diagnosed with breast cancer. Thankfully, she's 10 years in remission now, but undergoing those personal and life challenges all while being in a new setting, it's not only important to continue to keep people around you that are achieving the same goal, but also having mentors to help guide you. So some things that I wish that I knew at this point would definitely be one, a lot of people talked about their journey and kind of their career steps into medicine, but the more practical things are that should you be interested in going straight from college into medical school, the medical school application process is one, not only pretty expensive, meaning each application can cost a significant amount of money, but also the entrance exams are very important, and all of that process, studying for the entrance exam, taking it, as submitting the application, all of that takes about a year. And so during this process, although um, I had parents who are doctors. I was in an honors program. I didn't have a defined set mentor at that time that was helping to coach me through this process until I was at the end of my third year. And while as a junior, knowing that I wasn't ready to take the MCAT and I wasn't ready to go financially to go through the process to apply, I needed to brainstorm next steps. So I actually took a year, and we can advance. I graduated. This is me graduating. We can go to the next slide. These are to the left, you'll see some friends that I met while at my post-baccalaureate program through George Mason and Georgetown University, where I did a post-bac in advanced biomedical sciences and went on to get my master's in physiology at Georgetown. And during that time, the photo on the right was Providence Hospital, which in DC, which is now shut down. And this is one of my mentors at the time. But all while trying to navigate through the medical school admissions piece of things, I was studying and continued in this program. And I will say that that is normal. Everyone's path looks different into medicine. And now, believe it or not, the median age of a first year medical student is around like 23, 24. So meaning that there are people that are gaining life experiences, like getting masters, like going into the workforce and then going into medical school. So don't feel discouraged if you feel like this may be in your future, because everyone's path looks different. Here is me in medical school. I went to Howard University College of Medicine, which I'm very proud to have gone to two historically Black colleges and universities for my advanced medical training. On the left is actually our white coat ceremony, and these are my best friends in medical school, and we're actually still friends to this day. To the right is photos of us, some of my classmates and I taking our exams. And while in medical school, your first 2 years are going to be you taking your preclinical requirements and ultimately studying for step 1 and step 2, which are both of the kind of benchmark exams that you need to matriculate through medical school. And I will say during this time, it's tough. It's tough. It's completely different from college. You're in a new place studying to get an advanced degree, and you can't do it without people in support around you. And I will, if you can advance, I think there are more photos here. I will also say that it's important to take a look at where you want your sphere of influence to be. And so for me, not only was I interested in community outreach locally through volunteerism in the Washington, D.C. area, where I had the privilege of being vice president of community service for my class for 4 years. But what was also important to me was getting outside of the confines of Washington, D.C. and serving others internationally. So on the left is me and my classmates in Lima, Peru, doing a medical mission trip. And then again, on the right, we went to Gondar, Ethiopia. So I'll say my take home point for this slide is that not only is it important to keep keep up your grades and stay motivated by those that those are your peers, but also to think about who you want to serve and who you want to receive benefit from you becoming a doctor, which is so important. And then residency. So like some of my other colleagues on this call, I matched into my number one choice at Johns Hopkins for residency, where that process was 3 years. On the left is a picture on my first day of residency, and on the right is a photo of me in the ICU in my third year. And during that time, I knew that I had a preference for learning about cardiology, but getting more clinical experience and learning more about the pathophys, I knew that I was interested in cardiology and went on to apply. And this is me. The point of this photo here is not only maintaining that clinical acumen, so making sure that you're serving patients, caring about peers around you, but also thinking to yourself, how can I advance the field of medicine? And so thankfully, I was able to get research mentors earlier on in my residency career, and I went on to present publications. And so I would also encourage you all to do the same in thinking about how you can advance the field of medicine. And now, that landed me here where I am today, a first year fellow, navigating the new challenges in fellowship. And I will say that, some of those things being the things that were already discussed, but the one point in particular being imposter syndrome, thinking that I went through all of this stuff, I was credentialed, but internally I still don't feel good enough. And that is something that may or may not tug at you a bit. And how I overcome that every day is obviously by positive affirmations and pumping myself up, but also just continuing to keep the main thing, which is being a good doctor and taking care of patients. So having a good attitude and continuing to read more and think about how you can advance the field of medicine in your own special way.
So much, Dr. Anderson. We're gonna move on to our final speaker, Dr. Torres.
Hi, Dr. Torres.
Look, it's, it's Dr. Anderson. Hello. Very nice to see you. Hi, everybody. So I don't have slides, so you'll see this face for the next 10 minutes, which I'm guessing will be fine. So I'm Guillermo. Hola a todos. Born and raised Puerto Rican, Boricua. I will say it loud, proud all the time. So I am an adult congenital heart disease fellow, and that's a very lengthy way of saying I take care of patients essentially throughout their life from youth to adulthood and dealing with congenital diseases that affect the population. And we'll definitely get into what the weeds of that all in terms of training imply. But going back to the basics, this all started, a very long time ago. Obviously, I am now PGY10. But in Puerto Rico, I am born to, my mom is a teacher, my dad is a lawyer, no medical background whatsoever. I actually thought I was going to be an architect at some point. I used to dribble or draw everything I saw. And I was kind of lining up towards doing that. And then it not necessarily hit me. I just, at a point, wondered to myself, what is my life going to look like? And I asked my mom, it's like, Mom, what should I do? Um, I love these two things so much, medicine and caring for people, but then also, drawing and the passion and building stuff and um, helping people in other ways. And she said, well, what in, 10 years from now, when you're practicing or you're doing what you love, where do you see yourself? Are you drawing? Are you planning? Are you collaborating with others and help designing? Or are you there at the forefront and you're touching people and listening, and trying to have impact on that way? And I think that kind of made all the difference. I knew that I wanted to see patients, talk to patients, learn about their lives and, treat them. And essentially from there on, that was the passion for medicine, which I'm sure a lot of you now share. So that was kind of the first thing, obviously, that kind of defines what you'll do, and never lose sight of what makes you passionate about medicine, which at the end of the day is, patient care and changing the way that we practice through research and through the medical care that we provide on a daily basis. So from there, it was, well, what do I do? So I'm in med school. I thought I was going to be a neurosurgeon. Obviously, that's not the case. So I had a pediatric cardiology lecture. And I'm looking at all these diagrams, at all these kind of defects that happen very early in life, all the ways that a heart can go wrong, but then somehow they make it right. They get fixed. Kids are resilient. They survive. And then the question mark comes, what happens then, right? Like, what happens to these patients when they've been undergoing surgeries throughout most of their early lives, and then all of a sudden they're 18 and then have to see a specialist and start taking care of themselves, but they don't really understand their condition and then don't really understand what they went through. So that got me into the thought process of transition, right? There's got to be a way for us to kind of help steward patients from youth into adulthood. This is in Puerto Rico. I had no idea what MedPeds was. I had no idea it existed. So I just started typing in Google what transition of care, what that looked like. And I got introduced into MedPeds. And I'm like, oh, okay, so there's actually a specialty. There's something I can do that allows me to have the information and the thought process to appropriately care for these patients and help transition and guide them. So that led to the problem. Okay, well, I'm in Puerto Rico. There's no MedPeds. What do I do now? Do I just apply nationwide and try to figure out what I can do? So I just reached out to a mentor at that time who was the chair of pediatrics. And he's like, well, now that you mention it, we are going to start a MedPeds program. And that will happen actually when you finish med school. So that should work. And I'm like, okay, sure, let's do that. So that introduces the whole thought of, well, one, obviously, always ask. You never know what's in store, what you can find if you don't ask. But then two, it also brought this whole scenario of navigating a new specialty in Puerto Rico, which has never been done before, but then also being the first one to do it. And then being in between internal medicine and pediatrics, and then some saying that you don't really kind of belong in either one, and then others saying, well, what's the difference between what you do and what a family practice practitioner would do? So kind of defining your pathway led to a lot of struggles, but I don't regret it in any way. It's what has helped me grow and has helped me, practice in a way that it's very individualized. But um, again, I wouldn't have it any other way. Um, Kind of learning to make your own path, and defending what you do, and realizing that there is a role for essentially a transition of care practices, like throughout specialties, right? This is not just for cardiology. You can essentially practice this model for all. So for those of you that are not necessarily undecided, but between pediatrics and internal medicine, but are also curious about, how do I ensure that everything that we have invested in the pediatric forum continues and just uh, um, continues to reflect healthcare, and then outcomes improve in adulthood. I encourage you to look into MedPeds, obviously, as a practice for residency. Um, so I finished MedPeds. I fell in love with pediatric cardiology. So next problem, I finished MedPeds. There's no pediatrics or specialties in Puerto Rico. So I have to fly. I have to get out of Puerto Rico and see what I can do. And then I start looking into pediatric cardiology, and obviously there's nothing like Hopkins to define literally pediatric cardiology. This was the birthing place with Helen Taussig, in terms of the Blaylock Taussig shunt. It's the birthplace of pediatric cardiothoracic surgery. It's where like countless people have come. I had like multiple experiences back home for patients who ended up flying from Puerto Rico to Baltimore because essentially there's nothing that could be offered. So they needed essentially a lease in life. And they came here and they did well, and have continued to do well. There are patients that I see in clinics. So it was kind of a no-brainer to be able to practice. And thankfully I matched here and was able to, complete my training in pediatric cardiology. Um, and then after pediatric cardiology, I'm now doing adult congenital heart disease finally. So overall, I will say it's a very lengthy process. So it's the 4 years of college. Then I did 4 years of medical school, 4 years of internal medicine and pediatrics, 3 years. I added an extra year. I did 3 years of pediatric cardiology and then a year of advanced imaging. So I do cardiac MRIs as well. And then 2 years of adult congenital heart disease. So by the end of that road, I will be able to practice. And there are different ways that you can get to this final stage. You can come through the pediatric cardiology route, just as I did. You can also do general cardiology, like Dr. Anderson, and then from adult cardiology, go on to adult congenital heart disease. It all depends on kind of what you want your practice to be. I knew that I wanted strong ties to pediatrics, and there's nothing quite like being in the critical care unit for an adult patient and then going to your clinic and seeing a nice little 6-month-old. It's just amazing to see. And the same goes in terms of resilience, and the way that they can come back from surgery is outstanding. So I don't regret it in any way. And then something that, if again, I don't want to overpass my time, but something that's quite unique about adult congenital heart disease as a subspecialty is actually quite new. The first board was taken in 2015. So actually, if all the adult congenital heart disease specialists that were board certified, this is the first time that they will recertify. So it's quite young, and in that sense, the possibilities are endless. There's so much research because this population is so underrepresented, and so most of the trials obviously will not include congenital patients. So there's a lot to learn. There's a lot to know. Your practice varies daily. Again, not only from pediatrics to adults, but also within one specific lesion, such as a transposition of the great arteries. Throughout the decades, the way that patients have been intervened upon has changed. So you have one lesion, but it can present in so many ways, and it makes it so interesting. So you will never be bored. It is a lengthy process to get there, but once you're there, it's so rewarding. So I highly encourage you, obviously, if it's something that you're interested in, to reach out to me. And then one final thought is the final thing that Dr. Anderson said. Imposter syndrome is real, especially coming from Puerto Rico and then not knowing, and then you hear about Hopkins and other obviously universities, and you always wonder whether you're good enough, but you are good enough. You've made it so far. Just continue to trust yourself. Surround yourself by people who believe in you, who shower you with positivity, and then find strong mentors that will lead you through this path. That's essential.
Thank you so much. A wonderful note to end on. I'm gonna stop the recording.